Well, here's where the federal government shutdown now sits at day 17. The government shutdown will now extend into next week. We know that as senators are leaving Washington. Yesterday marked another failed attempt, the 10th time for senators to pass a funding bill, and they also rejected a separate military funding bill. A sign the Democrats are not willing to pass normal appropriations bills during the government shutdown. And House Speaker Mike Johnson also signaled that he might be willing to leave the House out of session indefinitely. Well, at the center of Washington's big budget stalemate, a fight over how much Americans pay for their health insurance. The enhanced tax credits under the Affordable Care Act are set to expire, which threatens to double premiums for millions of people. More than 20 million people rely on ACA subsidies to keep their health insurance affordable. And without the enhanced tax credits, average monthly premiums could jump from close to $900 to more than $1,900 next year. Congress must act soon as these enhanced tax credits disappear at the end of next year, right as open enrollment is getting started. But yesterday, leaders on both sides of the political aisle blamed the other for dragging their feet on this issue.
The American people are in a crisis in health care, and we are fighting for them. We are on their side. The American people are seeing that we are on their side, doing everything we can to get the Republicans to negotiate and address this crisis.
The Obamacare subsidy issue is not the issue of today. It is in a subsidy that expires December 31. We were always planning to continue the debate and discussion about that issue in October and November. Ironically, Democrats are taking the time off the clock for us to do that.
So let's break down this morning what's really at stake with Dr. Stephen Patrick, chair of Emory University's Department of Health Policy and Management. Great to have you on with us this Friday morning. Let's start with this. How significant are these ACA tax credits that we were just talking about to keeping health insurance affordable?
Well, they are significant for the people who receive them. And let's talk about who that is. We're talking primarily about people that are middle class. These are people who don't get insurance from their employer. They don't qualify for Medicaid or Medicare. And so they're getting subsidies to help them buy health insurance on the marketplace.
And that's important because, a lot of people, it's the affordability that we're talking about here. And how has the expansion of these credits under the American Rescue Plan and the Inflation Reduction Act actually changed who can afford health insurance now?
Well, it broadened the spectrum. It made it to where some folks with a little bit of a higher income could be eligible for it. And it also made it to where folks who are in the lower income spectrum of things. One of the things we know is that different people in different places have different levels of eligibility. So, for example, looking at someone who makes a family who makes $75,000 a year in DeKalb County with a family of 4, what they're going to see is about a $200 a month increase in their premiums. And
that affects a lot of people who may already be on a tight budget. So we've heard a lot of back and forth, a lot of finger pointing from Republicans and Democrats. And so when they're arguing over the subsidies, some saying it costs too much, what do you feel might be missing from the conversations about the economic impact in particular and the health impacts as well?
Well, one thing that we know is that some of the estimates are between 2 and 4 million people will lose health insurance. And when people lose health insurance, they become sicker. They might, present to our emergency departments with undiagnosed cancer, whatever that might be. And we all pay for that. We pay for that in our premiums, and we pay for that in lives lost of our neighbors. One thing that I'm mindful of too is that before the Affordable Care Act, the policies we had were pretty bad. So one example, my parents were self-employed before the Affordable Care Act. My mom had a policy on the individual market that had things like lifetime caps on chemotherapy, which she hit when she got sick. So we had policies that were bad, they were not affordable. So what the subsidies have done have made better plans more affordable for more Americans.
All right, well, let's talk about Georgia in particular. Georgia's ACA marketplace has seen record enrollment when you're looking at the last 2 years. How much of it is tied directly to those expanded subsidies we're hearing about?
We know that people respond to incentives. When you make health insurance more affordable, people are going to sign up. And it's important that we get more people to sign up. The way health insurance works is, we want as many people in it as possible. And that's because we need a lot of healthy people to be able to balance the folks who might be sick. The thing is that, you and I, we don't know if we're going to get sick in the next year. So we have to sign up for health insurance so that we're all in the pool together. So the more people we have sign up for health insurance, the better that is for all of us.
It is. So if Washington, let's say, pulls back on these subsidies, if they did that today or tomorrow, could Georgia fill the gap on its own?
Well, that's a good question. I think many states would really struggle with this. We've seen over the last 7 months increased financial pressure placed on states from losing federal funds in various ways. And so I think states would really struggle to fill that gap. The other thing is that many states have to have balanced budgets. And so they have to find the money somewhere. And so when states are shifting around money, where does that come from? Does it come from schools? Does it come from elsewhere? So that's one of the challenges I think states like Georgia are finding themselves in.
And before you go, I do have to ask you this. We heard that this shutdown could continue perhaps until Thanksgiving. Let's hope it doesn't. But is there a compromise in the meantime, a solution perhaps between pulling the subsidies altogether and extending them at some point indefinitely?
Well, I certainly hope so. I think the current situation doesn't serve any of us well. The shutdown is having a devastating impact on many folks across the country. And also, we have a problem with affordability of health care. Certainly the subsidies highlight that. But we do need everyone to come together and come to a solution that opens the government and makes health insurance affordable for folks in Georgia and beyond.
All right, we'll see how this all plays out. Dr. Patrick, thank you so much for joining us on this Friday. We appreciate your insight.
Great to be here.